Breast cancer is the second most common cancer in women, and in the United States, 1 in 8 women will be diagnosed with invasive breast cancer within their lifetime. This is Stephanie. Stephanie is a 40-year-old female who recently went in for her first mammogram appointment. Stephanie usually does monthly breast exams on herself, but hasn't in a few months because of her busy schedule. She has no family history of breast cancer. Sadly, when Stephanie went to her doctor appointment, she was told that she had an abnormality on her scan. She was sent to have a sonogram and a biopsy of her breast.
Breast cancer, breast carcinoma, is uncontrolled growth of epithelial cells in the breast. Breast cells undergo a series of changes leading to an outgrowth and spread of cells. Apoptosis becomes ineffective and an uncontrolled growth of abnormal cells begin. The cancer then spreads by way of the lymphatic system in the bloodstream, which travels through the heart and the lungs and other areas of the body. Within a couple of days, Stephanie received the results of the biopsy and was diagnosed with stage 3 breast cancer. Stephanie has 2 children, a 3-year-old and a 10-year-old. When talking to her sons, she told them that she might look different, lose her hair, nap more, and get weaker, but she is there for them. Her husband and her came to the conclusion that they need to take out an extra credit card for the medical expenses. Fast forward to 3 months in the future, Stephanie has undergone a double mastectomy and is currently undergoing chemo and radiation therapy. It is important to educate our patients on the following: making sure that they go to all annual checkups and all doctor's appointments, perform monthly breast exams on themselves, teaching the signs and symptoms and the prevention of infection.
If the patient is receiving external radiation, it is vital not to erase radiation tattoos. It is important for patients undergoing chemotherapy to have no fresh fruits and veggies with no spicy foods. We encourage small, frequent meals, around 6 to 8 meals a day, and bland food.
When it comes to nursing assessments and interventions, women do not experience pain or discomfort until the cells have spread to nearby tissues. It's crucial to help the families cope with the diagnosis as well as the patient. If surgery is indicated, monitor the patient's incision site closely for infection. It's important to make sure the patient is up shortly after surgery to reduce the risk of ailments such as DVTs, upper respiratory infections, pressure ulcers, or atelectasis. When caring for a patient undergoing chemotherapy, remember to double bag bodily fluids, double glove, cluster care to reduce fatigue on the patient, monitor lab results, and monitor the catheter site every hour when chemo is infusing. Perform CSTM assessments, reposition the patient every 2 hours, and control the patient's acute and chronic pain using pharmacological and non-pharmacological interventions.
Ensure that the patient has advanced healthcare directives filled out, and if they don't, it is important to encourage that conversation. If the diagnosis is terminal, it is crucial to discuss hospice, palliative, and comfort care with both the patient and their family. Patients are able to use pharmacological and non-pharmacological interventions to manage symptoms such as nausea, pain, and fever. Keeping the patients comfortable along with preventing further infection by initiating neutropenic precautions if indicated. Working as a team with all doctors to provide the best care for the patient is crucial.
She has been struggling with her self-esteem due to her hair loss, anxiety, depression, and hopelessness. She is angry with herself because if she kept up with the monthly breast exam, she wouldn't be in this position. Stephanie was sent to a support group to help her deal with her emotions and deal with her diagnosis.
This is Stephanie. She is a 40-year-old woman. Stephanie has found lumps in her breasts before, and she's been followed by a breast specialist by the recommendation of her primary doctor. Stephanie does at-home breast exams the 15th of every month to make sure no new lumps have formed. Stephanie recently made an appointment with her breast specialist because she found a new lump and it feels extremely different. Stephanie was sent on to have a sonogram and a biopsy of her breast. Unfortunately, they found precancerous cells in her breast. However, it was so early on that she just had to have the lump removed and monitored every 3 months to make sure no new lumps have formed. Stephanie saved her own life by doing at-home breast exams every month.